Hello, I'm Dr. Chet from WH Hospital. When we talk about gender-affirming surgery, many people may think only of surgery involving the genital area or the creation of the vaginal canal. But in fact, gender-affirming surgery has a much wider scope. It also includes other types of procedures, such as surgeries in the category of facial feminization surgery, which reshape the face from male to female, or surgeries that modify the male voice to become a female voice, called voice feminizing surgery, and procedures that reshape the male body into a more feminine form, called body feminization surgery. In this clip, we serves as an introduction. I will point out the key anatomical features that indicate male characteristics in different areas of the body, as well as the types of surgical procedures that can modify those features to achieve a naturally feminine appearance. Number 1. Observe the forehead area just above the eyebrows. If there is a noticeable bony ridge or protrusion, it indicates a probability of being male at over 80%. The reason why this bony area in males is thicker or more prominent than in females is due to the influence of the male hormone testosterone. Surgery to reduce the brow ridge can be done by bone contouring or forehead bone reconstruction to transform a masculine-looking forehead into a softer and more feminine one. Number 2. Observe the Adam's apple, which is actually the cartilage of the larynx. In females, the larynx does not enlarge, so the angle of the cartilage appears rounded and does not project outward. In males, testosterone stimulates the growth of the larynx, making it larger and forming a clearly visible Adam's apple. The surgical procedure used to reduce the prominence of the Adam's apple to make the neck appear smooth and feminine is called trachea shape. Number 3. The next point is the pitch of the voice, whether the voice is high or low. In males, the vocal cords are thicker and longer, resulting in a lower voice. In females, the vocal cords are thinner and shorter, producing a higher voice. For patients with a lower voice who wish to raise their speaking pitch, this can be achieved either through voice training or through surgery to modify the shape of the vocal cord. Number 4. The shape of the jaw and chin. In females, the jawline and chin appears narrower and smaller, while in males, the jaw is wider with a sharp angle and a more square-shaped chin. Surgery to refine the shape of the jaw and chin to make the face appear narrower can transform a masculine face into a softer feminine one. Number 5. The shape of the pelvic bone. In females, the pelvic cavity is wider and rounder to accommodate pregnancy, making the hips appear broader and more curved. In males, the pelvic bone is narrower and steeper. Nowadays, it's possible to increase hip width by inserting implants along the sides of the pelvic bone, a procedure known as pelvicplasty. Number 6. The distance between both shoulders. In males, the average shoulder span is 44 to 46 centimeters, while in females, the average is 38 to 40 centimeters. At present, we can perform surgery to shorten the length of the clavicle bone, reducing the shoulder width by about 4 to 5 centimeters, which corresponds to the typical difference between male and female shoulders. Number 7. The appearance of the nipple and areola. In males, the diameter of the areola is usually less than 3 centimeters, and the nipple itself is not very prominent. Therefore, even after breast augmentation, the shape and size of the nipple and areola can still give a rough indication of whether the person was originally male or female. In the upcoming clips, I will go into detail about each procedure in the feminization surgery category, one by one. Please stay tuned.